Hi, this is Brian Kim. I'm going to share the mechanical fracturing series, case number 2, the soft lens. And so the soft lens you would think is a fairly easy lens to remove, but there are several challenges. Number one, the soft lenses can be difficult to manipulate due to the softness of the lens material. During lens manipulation, there's not enough resistance in the lens material, and so the instruments just cheese wire through the lens. Number two, if you have a poor hydrosection wave, it can be difficult to spin the lens within the bag because this lens is so soft and it's difficult to manipulate. Sculpting techniques struggle because after the groove is made, the lens is difficult to crack due to the soft material. Horizontal and vertical chop techniques struggle because these depend on holding the lens with high vacuum. When trying to hold the lens with high vacuum, instead of staying at the tip, the soft lens can get sucked out by the high vacuum. The chop is ineffective, or worse, it can expose the posterior capsule to the phaco tip, which can lead to posterior capsule rupture. So why mechanical fracturing? It's a minimal use of ultrasonic energy and vacuum technique, and so this is safer and more controlled. It works for all lens densities, and so it's the most versatile technique above all others that I've tried, including divide and conquer and all the chopping techniques. But it is predicated on placing chopper out to the equator confidently and correctly. People ask me, oh, this looks dangerous. Oh, you might rip the zonules. Well, yes, you can do bad things with cataract surgery, but that is the case for any technique, not just for this technique. If you do the technique wrong, you will cause complications. And that's just a basic tenet for all surgical techniques. And so as long as you perform the technique correctly, you place the chopper out to the equator within the capsular bag and you perform the maneuver. This is one of the safest, most efficient, and best ways to do cataract surgery, in my opinion. So now I'm going to show you the entire case of the lens disassembly of this soft lens from beginning to end at normal speed. First, I'm going to remove the surface lens material, placing the chopper out to the equator. I'm going to crush the lens with the double chop technique, and then I'm going to place the chopper out to the contralateral equator for the cross chop technique. All the maneuvers are performed within the capsular bag, and there's no ultrasonic energy or vacuum used during the entire disassembly of the lens. The chopper is a primary manipulator of the lens. I like to use the chopper to pull the lens material to the center, and this helps ease access for the phaco tip to the lens material. And then I'm here rotating the lens in front of me, placing the chopper out, placing the phaco deep in the bag, cracking, and then grabbing, and then crushing the lens material in between the chopper and the phaco tip. As you can see here, every manipulation begins with the chopper bringing the lens towards the center, towards the phaco tip, crushes the lens material, again, without any phaco or vacuum, and then pulsing with the vacuum to emulsify the lens material. By using the chopper as the main manipulator, bringing the lens material to the center, and then leaving the phaco tip in the middle, you're keeping the phaco tip at the central safe zone, and this allows for the safest way to do the cataract surgery. Okay, so now we're going to show this entire case in slow motion, going over each step. This is the double chop maneuver. I'm placing the chopper out to the equator. I'm first pronating my hand and sliding the chopper underneath the anterior capsule, gliding across the lens surface, and then supinating my hand. Once I get into the capsular fornix in proper position, I'm tilting my phaco tip in a more vertical position in the subincisional area. Again, this is all still within the capsular bag, anterior capsular opening diameter. Again, both instruments, the chopper and the phaco tip, are in a more vertical position. I slide both instruments together and it crushes the lens. Again, because there's very, very little resistance with the soft lens, this works very, very well. No ultrasonic energy or vacuum is used, and the lens is cut effortlessly with the mechanical fracturing principles. Minimal movement is the hallmark for efficiency and elegance to cataract surgery. So with the phaco tip still in the same place without moving it at all from the original position where it is, you're going to place the chopper out to the contralateral equator. I'm going to pronate my hand to glide the chopper underneath the anterior capsular rim, and I'm sliding out to the periphery. And when I get to the capsular fornix, I'm going to supinate my hand in the proper position, making sure that the chopper is within the capsular fornix. I'm going to pull my chopper towards the center, towards the phaco tip, to cut the contralateral heminucleus in the cross chop technique. Again, no ultrasonic energy or vacuum is used. The lens is cut very easily because it's very soft. There is no manipulation outside of the capsular bag, and because every movement is within the capsular bag and the forces are centripetal forces to the center, this is a very safe and efficient way to do the lens disassembly. So now within seconds, you have 3 lens pieces using the double chop and cross chop maneuvers. At this point, you're wanting to access the lens for emulsification. And so you use the chopper to pull the lens material towards the central safe zone where the phaco tip is waiting, and then you will emulsify by crushing the lens material within the central safe zone. You never want to go and chase pieces with the phaco tip in the periphery. This is very poor technique, and you can cause posterior capsule rupture. And so again, I'm placing the chopper out to the equator, I'm pulling the lens material into the center, and then I'm crushing the lens material between the chopper and phaco tip in bite-sized pieces, and then I pulse the foot pedal so that I can use a vacuum and ultrasound to emulsify the lens with, again, minimal ultrasound as possible. It is my opinion that any lens disassembly technique that requires or depends upon spinning the lens within the capsular bag is a weak technique, because the truth is sometimes hydrodissection doesn't work. You have weak zonules, and so it's difficult to spin the lens within the capsular bag. So the solution is to adopt a technique that does not require spinning the lens within the capsular bag. And so this technique, by using the chopper to pull the lens material towards the center, you can easily access the lens material. You can see that this lens material that's down and to the right, I was able to use a chopper to pull that lens to the center and then begin emulsifying the lens. The mechanical fracturing principles are fairly simple. You want to be as safe as possible, and therefore you're using all the lens material manipulation within the capsular bag, and it's all centripetal towards the center, which means this is minimal zonular trauma or contact, and you're using mechanical fracturing to crush the lens material as much as possible. And because, again, sometimes it's difficult to spin the lens, it's better, far better, to be able to pull the lens material towards the center with a chopper. And I think this is a much safer way to do things. Again, using the ultrasonic handpiece to grab the lens material with high vacuum, although it can work, occasionally leads to a complication. This technique helps minimize that complication. So now we're going to bisect this heminucleus. I'm going to again place the chopper out to the equator. Again, I'm pronating my hand. I'm sliding underneath the anterocapsular rim, and I'm gliding horizontally. As I get out, I'm going to supinate my hand, making sure the chopper is into the capsular fornix. I'm going to place the phaco tip deep within the capsular bag, and this allows me to make sure I'm definitely crushing the bulk of the lens material between the chopper and the phaco tip. I bring the instruments together, and this easily crushes the lens material. The lens material is manipulated so it is between the chopper and phaco tip. The chopper and phaco tip are then brought together to crush the lens material. The phaco pedal is then used by feathering it to pulse and remove the lens material, in this case with high vacuum. The last quadrant is then manipulated again by placing the chopper out to the equator, again by pronating the hand, sliding it out under the anterocapsular rim, and then supinating once it's into the capsular fornix, and then crushing the lens material between the chopper and phaco tip. I've had surgeons ask me, how do you make sure that the chopper is definitely within the capsular bag when you're placing it out to the equator? It's fairly simple. Again, I like to pronate my hand to make sure the tip is facing towards the periphery. Some people like to supinate it, and because it's really more intuitive that way. But the reality is the elbow of the chopper can slide inadvertently above the anterior capsular rim that way. And so I don't advocate that. I advocate pronating the hand, making sure the tip is pointing towards the periphery. Again, when you do it that way, it makes sense that the leading edge of the chopper is the most posterior. It's at the lowest point. If you supinate your hand, the leading edge is actually at the elbow, and that's actually higher. And so you'd have to really push down on the lens material to get the entire chopper underneath the anterior capsular rim. If you pronate your hand, the tip is actually at the lowest part, and so it's touching the lens. I like to touch the lens and push down a little bit and glide across the lens material. Again, while I'm pronating, the chopper tip is leading, and I see it glide across and past the anterior capsular rim. Once it does that and it's within the capsular equator, I'm going to supinate my hand, and I make sure that the chopper kind of goes down into that space, and I'm ready to go. So that's the key, is making sure that the chopper is within the capsular bag, within the capsular rhexis rim. And again, by doing that, you like to lead with the chopper tip, again, by pronating your hand and then you want to apply gentle pressure, pushing down a little bit on the lens material, and I'm gliding through the surface lens material as I do that. If you do that and you follow that principle, you will not accidentally be outside of the bag, and you will not accidentally rip the capsular bag or the zonules with this technique. Whether it's with good visualization or even with a small pupil, you can chop the lens material very safely. So this is mechanical fracturing technique of the soft lens. You saw how easy it was. There is no reason to struggle. If you do this technique, you will do soft lens cataract surgery very easily. Thank you for your attention.